Hadi Shah. I am the Chief Medical Officer for the Performance Lab, and I'm also the Executive Director of Sports Medicine. My background is in primary care sports medicine, and what that means is a family medicine residency and then a fellowship and board certification in sports medicine. Sports medicine is pretty broad and encompassing. A lot of people think it's like surgeries, but it's not. I kind of describe it more as non-surgical orthopedics. So anything orthopedic doctors can do, a primary care sports medicine doctor can do minus the surgery. Did my training up in North Carolina, fellowship out in Las Vegas, and since have been in the Tampa area doing various jobs, working in urgent cares, ERs, private practice, hospital clinics, most recently a concierge office, and now to the Performance Lab. I think it was my parents, first of all, growing up, immigrant family, they were like, hey, you're gonna go into medicine, right? And because of the obvious job security that offers us as we get older. And then growing up as a kid in North Carolina, right, it was obsession with every sport, playing basketball and football, mostly. I think when you get to the point where you realize that, I'm not going to be playing at any higher levels, you try to figure out, well, how do I stay connected and get the best of both worlds, right? And to me, watching sports and seeing the interactions of, athletes when they're injured with, their medical teams on the sidelines and locker rooms, I was like, that's what I wanted to do. At an early age, it was like, when I finally, admitted to myself that I wasn't going to go far in sports, it was like, that was my way to kind of stay connected. I'll say athletes, professional level, they really buy into process, right? And the system that's in place for them. They really work hand in hand with their medical team and kind of really rely on us to give them, unbiased, unfiltered, evidence-based kind of recommendations on what they can do to perform better, to get better, from simple things like sleep and nutrition and the, genetic predispositions, just anything and everything that they know that they can tap into and leverage to, hey, can I make it a little better? Realizing that, cumulatively that those little things add up, and then, then when the time comes, they can perform at their peak, and that's their purpose. And so kind of similarly, like, why can't that philosophy approach be, given, sent out and let the general population kind of tap into a similar kind of concept? And I think that's the model of TPL and what's so appealing to work in a facility like this. The system is very fragmented. Medical care is not efficient or streamlined. People are getting sent all over areas and waiting prolonged times to get in for appointments, see the doctor they want to see, get imaging, PT, just everything is kind of all over the place, right? And here, with everything under one roof, everything is a little more cohesive, and when people come in and for evaluations and referrals, they can get their assessments, their evaluation, their diagnosis, see all the doctors they need to see, tap into their physical therapy, tap into the sports performance tech that we have, all in one spot. And again, that could be to high-level athletes, to your day-to-day athlete too. A common mistake that you see in athletes, high level, lower levels, and even in the day-to-day person, right? People can sometimes not pay attention to details. I'm always like, hey, pay attention, the details matter, right? And if you're feeling some kind of discomfort or pain, not to just, brush it off as, hey, this is a normal part of my, kind of like my progress. Relaying that information to your medical team, so that way it can be evaluated, assessed appropriately, and again, in this kind of model where everything can kind of be done in one place, get a more accurate, faster diagnosis, so that way you treat it appropriately, right? And not being dismissive of it, because that can be obviously detrimental. Come into one facility, see the doctor you want to see, get your referrals to go, get the appropriate diagnostic imaging, and get, sent for physical therapy, kind of use and leverage all those kind of like non-surgical treatment options to recover better. I think it's having that kind of access to better diagnosis and overall healthcare. For the right reasons, the Tampa Bay region in general is becoming a sports hub. with the obvious known professional teams in town, but even at the high school level, IMG Academy, and so on, all in this region, it's becoming a destination. People from all over the country, all over the world, are coming to this area to train, and we want to be a destination that some of these higher-end teams and facilities can send their players, because we're different than the traditional model of, again, going all over the place and seeing doctors. Everything can be done in-house, kind of using the sports performance tech that we have available to us, the right staff here, and just getting that more comprehensive medical care. And so, again, and not just only for athletes, but also for the Tampa community. It could be misconstrued as, hey, this is just a injury facility or whatnot, right? And it's more than that. Recovery from injuries is just one little piece of the big picture, and we want to be a destination for overall sports performance. People can come here and, yeah, they can recover from their injury with all the access and ability to tap into the providers and the treatments that they need. But then, hey, there's a crossover, right? They can come and get into the performance area, the side of things where they can actually optimize and maybe come out better. There's like I don't know if you would call it a misconception in medicine, that when you get injured, you'll never get back to your full potential. You'll always be a little bit of a deficit, right? And we want to kind of flip that, that thought to where, hey, if you get injured, not only can you recover, but you can actually walk out of here maybe better than you were previously. The very minimum, we should have here all the tech that they've already become accustomed to using. And that's, across the board, and people have seen it. There's different types of lasers and ultrasound machines to help optimize recovery. But then also, people can use motion analysis, force plates, biodex. There's all these, this tech that have become kind of mainstays in treatment and performance. And we have all that available to us here. We recently, vetted a music therapy that can be used to comprehensively treat brain injuries, and there's a lot of data and more data, that's research that's coming about that, and to show the benefits that it can have to help people recover from brain injuries. So we're constantly looking, and there's really no limit to, we always talk about it, there's no limit to what we would do to make sure that we have everything in-house that people can use. Hi, I'm Hadi Shah. Welcome to the Performance Lab.